Thanks to the development of the vaccines, there is hope on the horizon. As I said earlier in my last press conference, we're closer to the end than we are to the beginning.
Well, coming off a COVID fight himself, a positive tone from Governor Sisolak, something we haven't heard from him in a long time. Now, this as his vaccination team talked about getting a vaccine out to many of you. Those at higher risk for getting COVID will get the vaccine first, as well as those of you who take care of us.
Our critical infrastructure workforce in hospitals and medical facilities. Tier 1 also includes other medical provider types, correctional facility staff, and law enforcement. Of this first vaccine allocation, a portion will also be set aside for CVS and Walgreens, our pharmacy partners, who will work to vaccinate members of our vulnerable population who work and reside in long-term care facilities.
The state says people will get the vaccine in 2 doses. Once someone gets the first dose of the Pfizer vaccine, the state says they expect people to wait a minimum of 21 days before getting the second dose. For the Moderna vaccine, the minimum time you'll wait for a second dose is 28 days.
And it's critical to have both of those doses to get the full immune response.
And if you want to get the vaccine but are not part of the high-risk group or medical or correctional staff, your wait will be longer. I asked this question.
When do you estimate the general public will be able to get the vaccine once the first groups get it? Would you categorize in days, weeks, or months?
Our planning assumption at this point in time for the general public and what we can plan on is spring to mid 2021 for the general population.
For some, probably not fast enough, but that's not a concern for everyone, including those who don't plan to get the vaccine at all. Joe Vigil, Fox 5 News, local, Las Vegas.